Hi, Dr. Robin here from Grand River Eye Care Dry Eye Clinic. In today's video, I want to talk a bit about omega-3 supplementation and why I recommend it for patients with dry eyes, recurrent styes, or blepharitis. Omega-3 is a natural anti-inflammatory. It helps numerous parts of the body, but specifically where I'm concerned, it helps take inflammation away from the meibomian glands, which are the glands in our eyelids responsible for creating the oily layer of our tears. One question I often get is, I eat a lot of fish. Why do I need to supplement omega-3? Well, in order to get the same amount weekly dosage of omega-3 in the high quality products, you'd have to eat 37 cans of tuna that week. Now, can we say that we eat 37 cans of tuna? I don't think that would be really good for us. Let's supplement. Another important question is, how much omega-3 should I be taking per day? Well, we know that the effective dose for dry eye treatment is at least 2,000 milligrams per day. Now, if you look at the back of your package, either of your capsules or the liquid, what you want to look for is DHA and EPA. The combination of those two ingredients is what should equal at least 2,000 milligrams per day. Something else that's important to consider with omega-3s is the form that omega-3 is in. When taken from fish, the omega-3 is in a form called triglyceride. However, there's other things, there's impurities and there's toxins that have to be filtered out. And the way companies do that is they convert the triglyceride form into something called an ester form. Now, sometimes that's where the process stops, and in some of the cheaper products, it's in ester form. The problem with ester form is that it's not as absorbed by our bodies, and sometimes you can get that kind of yucky, fishy taste. Now, companies that convert the ester form back into triglyceride form increase the absorption rate and make a product that's much more effective. We call that bioavailable. So if looking for a product, I would look for triglyceride form and not the ester form. Now, you might have noticed that I'm only talking about omega-3. I'm not talking about omega-3, 6, 9. The reason for this is we get omega-6 in our diets. We get plenty of omega-6. Omega-9 is not considered essential. We create that in our bodies. But omega-3 is considered essential. It's not something that we create, and we simply don't get enough of it in our North American diets. Another thing that's important is that our fish oil is in a dark bottle. We know that light can cause oxidation of fish oil and turn things kind of rancid. So when you're looking for a bottle, make sure it's not clear, make sure it's dark. And if you choose a liquid form, refrigerate that form once opened. Now, I want to recap 5 important points about omega-3 supplementation. Number 1 is we know it's an effective and natural treatment for dry eyes, blepharitis, and recurrent styes. Number 2 is that we want to aim for 2,000 milligrams daily dose, and that's the DHA, EPA combined. Number 3 is that we want the form to be triglyceride form. Number 4, concentrated omega-3. Don't worry about the 6 and the 9. And number 5, look for a dark bottle. So my best recommendation for patients taking omega-3 is to incorporate this into your daily life. Aim for long-term. It's a long-term solution. It's not a short-term solution. Take the right amount. Take the right kind. If you're going to do it right. Now, if you're vegan and you don't eat animal products, the best form of omega-3 comes from algae. We do have that as an alternative to the fish oil. Now, if anybody has questions or concerns about taking omega-3, we'd be glad to answer them. Please email our office. Say goodbye to dry eye.